Good afternoon. We're grateful that you can join us for our briefing today. My name is Paul Edwards in the Governor's Office. We will hear first from Dr. Anegla Dunn, our state epidemiologist. She will be followed by Governor Gary Herbert, and then they will both be available to answer your questions. Dr. Dunn.
Okay. Good afternoon, or we're probably still in the morning. Good afternoon. We're in the afternoon now. So our updates for our numbers. We were at 13,252 cases of COVID-19 here in Utah. That is an increase of 388 from yesterday. We've tested over 250,000 Utahns for COVID-19, an increase of 4,908 from yesterday. We've had a total of 968 hospitalizations, and 818 individuals are currently hospitalized for COVID-19. We do have a total of 131 deaths, which is an increase of 3 from yesterday. One individual is a Salt Lake County resident over the age of 85 and was a long-term care facility resident. Another was also a Salt Lake County resident between the ages of 60 and 85 and was hospitalized at the time of death. And then the third was a Utah County resident between the ages of 18 and 60 years and was hospitalized at the time of death as well. So we have been experiencing an increase in our growth rate for the past couple of weeks. And this really started, right about after Memorial Day. Our daily cases have been in the 200 to 300 range since Memorial Day, with a few spikes in the 400 and 500 range. In the weeks leading up to Memorial Day, the percent of positive tests was hovering around 4 to 4.5%. In the 2 weeks since, we've seen the trend increase to 7% for a weekly average and then 10% positive for the last week. There are some parts of the state that are being hit harder than others, and there's localized outbreaks and hotspots. But by and large, we are seeing this increase in cases throughout the state, from Logan to St. George. However, there are definitely some specific communities within our state that have been seemingly spared throughout this outbreak up until this point. And it's likely because physical distancing is naturally occurring within these communities. For everyone, as we move forward, it is essential that we all modify our behaviors to prevent the spread of COVID-19, especially to those who are at high risk for severe disease. We need to learn to live with this virus, and that means we all need to physically distance, wear face coverings when physical distancing is not possible, stay home when we're ill, and continue to practice good hand hygiene. We've also adopted some changes to our color-coded phased guidelines. Some of these key changes that are occurring in yellow allow cultural events and activities to be allowed. Indoor venues are going to be limited to 3,000 attendees, and outdoor venues are limited to 6,000 attendees. The green guidelines places an emphasis on taking personal responsibility through individual actions to limit the spread of COVID-19. However, face coverings are going to continue to be emphasized throughout the phased guidelines. We're taking questions now? After? Okay. Governor Herbert.
Well, thank you, Dr. Dunn. It's good to be with you. It's been a while since I've been here for this press conference availability, and a lot of things have happened since our last press conference, and some things that are on my mind that I'd like to share today with you before we get into the questions. First, let me talk about something that's really been on the top of everybody's mind with the protests, the rioting, the violence that's occurred across our country. And Utah has not been immune to that. But like all of Utah, I think we were all horrified to see the killing of George Floyd, an African American, while he was subdued by those who've been sworn, part of their job and obligation is to serve and to protect. And we see that something went terribly wrong, and certainly in that instance. Such abuse of power is never acceptable. We have a social contract that's designed to help us understand the rule of law, where everybody no matter what their ethnicity, the color of their skin, their background, religious, sexual orientation, gender, is held equally under the law to give them safe haven and know that, in fact, they are going to be protected and they'll be served by those in law enforcement. We know that everybody should be holding to the law, and particularly those who are entrusted to enforce the law. Our social contract depends on all of us following the rules of just conduct and civility in our interactions with our fellow man. I believe when we witness these kinds of egregious actions, examples of cruelty from those who in fact are sworn to protect and to serve, it adds to the divisiveness that we should not want nor desire to have in our society. And when we see this, we can see that we have room for improvement. We can't ignore it. We can't say it's okay. We certainly can't say all is well in our society when these kind of things happen. Again, when we see that those who are entrusted to enforcing the law, enforcing the rules, they fail in that responsibility, then our social contract frays. And we've seen that happen across the country here in the last couple of weeks. I think everyone really wants to have fairness. I don't know of anybody that certainly would say we don't want to have fairness and equity under the law, but I think everyone deserves dignity. And I think that we have far too many people in our society, even here in Utah, that do not enjoy the fairness and dignity that the law desires them to have and the ideal that's set up by our United States Constitution. So within the executive branch of the state of government, we have two commissions. One is the Martin Luther King Commission, and the other is the Multicultural Commission. I convened those commissions under an emergency request to get together, and we had a joint session here this last Tuesday. And it was a very good meeting. It was heartfelt. It was honest. It was open. It was emotional. And I can tell you that it was something that I think was way past due and something we should have done earlier. I've been pleased with some of the efforts we've made in the state of Utah to address this issue in the past, and we've done some good things. For example, during my time in office, we've seen a major extension of civil rights to our LGBTQ community. We've enacted significant criminal justice reform laws, which makes it better for those who, particularly in lesser crime and nonviolent crime situations. We've had the passage of hate crimes legislation, historically done here in the state of Utah. We've added more diversity in my appointments to those who serve as judges on the bench at different levels. We've added significant diversity to the cadre of judges that we have out there. We've stood out as a community, uniquely so in some instances, of welcoming those who are refugees that are seeking refuge from evil and finding a safe haven. We've been a welcoming home for those who are less fortunate and those who are underserved, as we've provided a welcoming attitude and opportunities to find economic opportunity and jobs for those who are disadvantaged. So I can tell you it's been sobering for me as I've reflected upon the events of the past couple of weeks and reminded that far too many within our multicultural communities continue to experience discrimination. And we can, in the state of Utah, do better. I think we can as a country do better. Utah uniquely was founded as a place of refuge for those who are seeking to escape from persecution and from those who had hatred for them. We can do better to live up to that ideal of what our state was founded upon and our country was founded upon by improving our actions and our interactions with those that we associate with and in the policies that we, in fact, create. I will be meeting again with the Martin Luther King Jr. Commission and with the Multicultural Commission early next month to not only to continue our discussion, which should be a dialogue, open and frank and honest, but also to review the actions that we've taken and the actions that we will take as we go through these 30 days since I've met with them, a special session which will have some opportunities to address some of the laws and the policies that we have in the state of Utah. So I'm looking forward to having that next meeting and that next discussion with those two commissions. In the meantime, there are things that we can do right now to make a difference. So, effective immediately, the director of our Division of Multicultural Affairs, Nubia Pena, and the director of our Division of Indian Affairs, Dustin Jansen, will now begin to immediately report directly to me. This will not necessarily affect the current structure of the divisions, but Nubia and Dustin will now be part of our weekly leadership meetings and briefings and have the opportunity to report directly to me on issues that they see of a need and concern. Also, working with our Division of Multicultural Affairs, we will provide implicit bias training for all state government officials. This will begin with my next cabinet meeting in July, and then through successive layer of leadership in our executive branch of government. We've had this before, but we need to do it on a more regular and ongoing basis. Effective immediately, I'm also directing Commissioner of Public Safety Jess Anderson and the Executive Director of the Utah Department of Corrections, Mike Haddon, to enforce as executive policy what is now currently being taught through our post-training for public safety officers and correction officers. That namely is that no state public safety or corrections officer is permitted to use chokeholds or restraints that pressure the neck or the spine. And I'm calling upon all police agencies in the state of Utah, which there are many, to review their own policies to ensure that they are in alignment with our post-training that we have for all post-certified officers. And Commissioner Anderson will make sure that that's happening and that, in fact, that review process does take place. Commissioner Anderson also serves on the Multicultural Commission, is working to identify other ways in which public safety can decrease fear and anger in underrepresented communities towards law enforcement. I think we all agree that nobody should have fear of our police. It doesn't matter, again, what your color of your skin is, your ethnicity, your background. Everybody is equal under the law, and they should look at the police and law enforcement officers, men and women in uniform, as friends, somebody there to help. And to the extent that we need to change the culture so that's in fact the reality, we're going to work towards building that better relationship with all of the people of Utah, with our law enforcement agencies. We need to make sure that there's more trusting relationships, particularly with these underrepresented communities within the state of Utah and law enforcement. He's also working to identify potential changes in law and policy that might require legislative approval that can help to increase transparency and accountability for law enforcement throughout the state of Utah. I've directed for him to do this review process and have a report available to me by July 1st. These are important issues for me, and I believe for every Utahn. And I think there's a sensitivity to this and a desire to have action, not just talk about it, to do something. And as we do something and work together, I'm sure that our future will be brighter and certainly more inclusive for all people. And that certainly includes our underserved populations and our communities of color. Ultimately, the concern I have is not that we can put in policies in place. I think that's a first step. It may be the easiest first step to develop policies and fund them. Of a greater concern for me is what we need to be doing to change hearts and minds. That comes from families, that comes from parents, that comes from our faith-based organizations, our private organizations, all of us doing our own part to reflect upon our inner self and see what changes we need to make. What can we do to help others have that change of heart and mind so that we treat each other fairly with civility and compassion, love, and concern for their well-being, and to be a helper and not a hinder of their progress in society. Secondly, I will plan to call a special session of our legislature the end of next week. Because of the economic downturn caused by the pandemic, our state revenues have taken a hit. There's a decrease in revenues of what we had planned when we put the budgets together for not only fiscal year 2020, but for the new budget of fiscal year 2021. And so it's necessary for the legislature to meet and to make some modifications of the budget for 2020 as we close out the year on June 20th. We need to close that out in the black. And also for anticipation of what we will have available to spend for the next fiscal year of 2021. We don't, as of yet, have the precise numbers of funds which will be available. Picture, a lump sum of money that we need to carve up and find the best prioritization of the use of that money and the most effective use of the money, which is the budgetary process. I do believe, based on a number of things, that we will be able to weather this storm and be able to provide services to the people as they need. It's going to be a challenge to find how we do more with less, but I believe that we can do that, and here are the reasons why. One, we have been very fiscally prudent and responsible in good times. And you prepare for the bad times by doing the appropriate things during the good times. And as a state, we've done that very well. We're in much better shape than most any other state in America. We're one of only a handful of states, about 9, that have a AAA bond rating from the rating agencies on Wall Street, which gives us certain advantages. If we have to borrow money and bond, we'll get it at lower rates of interest. We've done that because we don't spend more than we take in. We live within our means. We don't have structural imbalances, which means we don't pay for ongoing expenses with one-time money. That's what the federal government does, and every year they have to borrow more and more and more money. We're up to $26 trillion in debt now. Try to figure that one out. That's not the way we do it in Utah. We don't spend more than we take in. We have rational debt for usually construction projects, which are one-time areas of need, buildings and roads. And we save for a rainy day. We have a rainy day fund for these kinds of situations as we move forward. We also have been unique in the country, and we're the first state to stress test our budgets, meaning we've tried to anticipate what would happen if we had bad economic times thrust upon us. One of the reasons why we've received favor from Wall Street is because not only do we live within our means, but we anticipate what the bad times will be and how we will, in fact, get through those. And again, we're in a good situation to modify some of our budget needs. We have some construction projects, for example, which are being funded one time by an ongoing revenue stream. We can replace that ongoing revenue stream with a bond, pay for the construction with a one-time need, and redirect that revenue stream to other ongoing expense needs. Because of that, with a little bit of tightening of our belt, which is going to be necessary, my hope is that we'll be able to keep education held harmless, for example, and not have to cut our education budget. Again, I think they've proven that the teachers and those involved with education have been very willing to adapt to the challenges and innovate and find better ways to do things. And some of that will be incorporated in the new school year as we come back together. I appreciate the work of our teachers and what their love of teaching and trying to make sure that our young people get a good education so they can go out into the world and get a good job. There may be also in this special session to have some look at some of our needed policy changes. We may need to look at some legislation necessary, again, for guidance for our law enforcement people, again, and what they can do as they have confrontations, what's allowed and what is not allowed. And so look for us to talk about some other things outside of the budget in this upcoming special session. So lastly, let me talk about what Dr. Dunn has mentioned here a little bit too. I know there are questions regarding our state's health risk and the guidance we have out there. We have color codes, sometimes a little confusing, but necessary to give us some guidance on what we should do and how we conduct ourselves. This is done really with the idea solely of how do we protect the public health which by legislation, by actual legislature saying these are the responsibilities of the local health departments to in fact ensure the public health and well-being, they have the ability to give guidance to businesses and people, which sometimes are a little bit annoying, but are nevertheless necessary, and the legislature has empowered our local health departments to make those tough decisions. But it's also a guide to help us not only protect people's health, but also to protect their livelihoods and to see, make sure that we can, in fact, in a methodical way, open up the economy. And I think that's good. Most of this is guided by common sense. There's no one that wants to return to normal. You know, we've called that kind of the new normal, which would be the green color coding, where we have less restriction and really back to a more normal society. Nobody wants to have that happen quicker than me. And I expect that everybody wants to have that to happen. And we're going to do it just as quick as the data will allow us to do that. I don't want to go forward and then take a step backward. And certainly as we see some spikes in the disease incidence, the risk infection rate in the past week in particular and 2 weeks overall, it gives us pause. You know, why is it happening? What is the cause of that? And what should we in fact do as a reaction to this spiking of infection? For the most part, I think the answer is that we will pause and really, for the most part, maintain yellow guidance in most of the state. Again, just a reminder that yellow, under yellow, our designation for most of the state right now, there are no economic activities that are categorically prohibited. We've not gone down the road, as many other states have done, of identifying essential or non-essential businesses and services. We've had minimal restrictions, in-house dining, public schools closing, which are not insignificant in its impact, but we have been listed as the fourth least restrictive state in America in addressing with this pandemic. We've not closed down the economy. And consequently, our economy is much better off right now today than any other state in America. The unemployment rate we have nationally is been at 14.7%. Utah is at 9.7%. The only state that has a lower unemployment rate than us is North Dakota. And they're a little more stable because it's mostly all energy. They just rely on what the energy is, and it stays pretty constant. We've been recognized as the one that had the least negative impact economically, and the state best positioned to recover. The Wasatch Front, we've identified, outside interests have said that the Salt Lake metropolitan area and the Utah County metropolitan area are those who are best poised to, in fact, recover and rebound at the post-pandemic time. So that means the Wasatch Front is ready to go. Our unemployment insurance claims have dropped for the last 8 weeks in a row. That's a good sign. We're having fewer unemployment than others around the country. And I think that trend will continue. We'll have numbers come out here a week from tomorrow, and we'll see how we've done. I hope that we've not increased unemployment, hopefully maybe had a decrease. We've had a number of companies during this pandemic that have looked to Utah as a place to expand their operations. They know that this is the best place in America for business and job opportunities, the place that has a great place to invest. Capital is flowing into the state of Utah in ways it's never done before. And we appreciate the fact we've created a very business-friendly environment that's allowed that to happen as we continue to expand opportunities going forward for economic growth and development. I think we've shown as a state and as a community here that with what we've been doing, that we can actually slow appropriately the spread of the coronavirus and yet still reactivate our economy. It is, as we've said many, many times, a balancing act. And how do we do this and balance it appropriately, thread that needle correctly so we protect the people? Clearly, we need to have added emphasis on those who are vulnerable in our populations. This coronavirus seems to be somewhat age sensitive and picks on those who are more elderly, over 65. If you have an underlying condition, you are more prone to have severity with the COVID-19 virus and a higher risk. So even as we move into yellow and have yellow virtually throughout the state, we need to make sure that we understand for those vulnerable populations, it's still a higher risk environment. So please practice social distancing and good hygiene. I strongly urge the use of face coverings. I know that wearing a mask is sometimes uncomfortable, inconvenient. Maybe people don't like the way they look. But this is designed to help us to help ourselves and our neighbors. I know there are people out there that are complaining it's a violation of their civil rights or the Constitution, some of the rights to assemble. We're not trying to violate anybody's civil rights or constitutional rights. We're trying to give you guidance on what is good counsel. Just like if you went out into the sunshine on a hot day that we have coming up in the weather, we'd advise you to wear sunscreen. That's good counsel. It'll help protect your health. Unfortunately, those who don't wear masks not only are endangering their own selves, but endangering people that are around them, their neighbors, their friends, people they don't know, but they ought to be concerned and have consideration for their well-being. So we would encourage, again, people to use the face coverings when you go out and when you can't have social distancing. When you go to retail outlets, we encourage employers to make sure that they have an environment that's conducive to safety for their employees and for their customers when they come in to shop. And as we all work together, we're going to be able to have success. This really is about people feeling confident that when I go out and wherever I go out, that I'm going to be safe. And nothing more than that. And we need to bring that confidence back to the community so we can continue to open up as we twist the dial and open up the economy, and people will participate because they're going to feel safe. So again, we all have a role to play, and I hope that we'll take that seriously and do our best to play that role by practicing good hygiene, social distancing, wear the mask, and do what we can to, in fact, slow down the spread of this coronavirus and this pandemic that we have here going throughout the world and certainly here in Utah. So with that, we'll invite Dr. Dunn to come back, and we'll open it up for any questions that you may have.
Hi, Sonia Hudson from KUER. I had a question for Dr. Dunn. Those changes that you announced to the color codes, specifically with indoor and outdoor venues, can you kind of explain why you made that change?
Sure. So the goal as we're kind of loosening up restrictions is to do it in a very slow and measured way so that we can understand the impact on the spread of the virus and be able to adjust really flexibly. So allowing these large gatherings to happen and these events to happen at this kind of more measured and controlled way is going to help us understand kind of how we can open up the economy and society more safely.
Let me just add, again, this is a major change that's occurring here as we've kind of twisted the dial. We had social gathering up to 50. We've expanded that beyond that number, over 100. Dr. Dunn has talked about how we could go to 3,000 and 6,000 in different kinds of venues if we have appropriate social distancing. We've asked people to adapt to the situation we have thrust upon us. It's not our fault, it just happened. So we adapt, but we also innovate, and we find better ways to do things. Our school teachers have done it with distance learning. That's not the answer, but it's certainly a way for us to tread water as we get from the red and urgency into now recovery, which we see coming here in the next few weeks. So, by the way, I just remembered, I should have mentioned that the process we have as we, throughout the state, we have 13 regions, and all governed by a health department. And the process is, if you feel like your designation you have needs to be adjusted, the local government officials need to make that decision and say, we think it's time to move from yellow to green or from orange to yellow. And then they meet and powwow with their local health departments and have a discussion there and see what the data informs them. And then if it looks good and they believe the data does justify a change of designation, then they'll work with the state health department. We have our incident command people will then review that data and make a decision on whether this data justifies a change. And if the data does, we're going to make the change. We have not had as many people request we thought that we'd get, but just a reminder to those out there in local governments, if you want to make a change, that's the process you need to go through for us to make an adjustment. One that we've had that's come in is from Kane County, and they've gone through the process, and the data does justify they have a low incident rate, virtually nobody being put into the hospital and using any beds because of COVID-19. And so we are granting to them, effective at 10 o'clock tomorrow, that they can go from yellow to green. So that's going to happen. I expect we're going to have others as we look at some of the data that we're getting close to probably being able to justify other areas of the state going from yellow to green. We had requests from Mexican Hat and Bluff in San Juan County to move to yellow. And again, the same things. The data justifies that movement. Even though they're on the border there, we have the Navajo Nation, which is really one of the hot spots in the nation. But there's significant distance there, and hospitalization rates are low. So the data informs us that they are justified to move to yellow in Mexican Hat and Bluff. And so we're going to announce that effective in the next 24 hours also. So those are some changes we've made. We'll be looking at others. We're concerned about some of these hot spots that are coming up. And we are going to be working directly with their local health departments, the local officials there, to make sure that we stay on top of this, see if we can discover what the causes are, and work, in fact, to stop that, and certainly the rise in the rate. We'll be working with our local health departments to make sure that happens. So that's something I should have mentioned on this change of status for a couple of our areas of the state. Again, back to the question.
Yeah, Governor, you announced obviously that Kane County is going to likely move to green status and Bluff and Mexican Hat going to yellow. But how long are we going to remain in yellow as a state? And do you foresee with these rising case counts, will some parts of the state, either Salt Lake City or other parts of the state, move to orange or stay in orange?
Well, like I said in my opening remarks, the rise in infection rate over these last couple of weeks, and certain locations which have had bigger spikes. Some can be explained because of meatpacking processing plant, which seems to be a hotbed of area across the country that's not unique to Utah. Long-term care facilities, again, have potential for a rise in the numbers. But other than that, we probably do not know. And so, as I said, it gives us pause. And so right now I'm kind of in the pause mode of moving us out of yellow to green. We need to see what the data shows us, see if we can figure out what's causing it. Is this just a new stabilization effort because we've got more people out and about? We expected there was going to be more infection rates because of people now getting out and having closer contact. We've had a number of events that have taken place as people have got together in closer contact, and we don't know what that's going to do over the next week or 2 weeks as far as the infection rates in the community. So I think we're wise to take a little bit of a pause on moving from yellow to green, certainly in the more populated areas along the Wasatch Front, and see what the data tells us over the next week. We'll watch and monitor that closely. That being said, you know, I'm anxious to get to where the data will show us to get to green and to a new normal. It won't be back to what it was in January before we went into this pandemic, but it will be a new normal. It will be more open and less restrictive, and I hope that we can get to that soon. But you know, a lot of that's up to us as individuals. Are we willing to do what we can do to slow it down, to be careful and cautious and concerned not only for ourselves but our fellow man out there by wearing a mask? And I hope that people will in fact take that as a serious charge and a challenge and have a willingness in fact to do that on a voluntary basis.
Thank you so much. And this is English News. I have a question for the governor and a question for Dr. Dunn. So first off, for the governor, some of some people talk about almost have moved on, the crisis being over, yet the rates are right now, at least, are the highest we've seen. And some people talk about coronavirus fatigue. So for the governor, how do we overcome that?
Yeah, just speaking as the governor, it's a concern for us that we see the rates rise and trying to understand the data and what it informs us to do as a policy. We want to have the economy open up too. We know that that's a big, serious issue. And there's other health concerns if we have a closed economy. So again, for us, it's striking the right balance, threading that needle where we in fact protect the public, give them information so they can control their own destiny. You know, if you're susceptible, if you're an elderly person, if you have underlying conditions, you probably are going to want to stay more at home rather than go out into society. You're more susceptible. Those who maybe are a little healthier, younger, maybe they're a little less susceptible and they can go out and do things that others in the vulnerable populations would be unwise to do. Again, all of us need to work together as best we can to get to the results that we need to have as a state. And we'll get there quicker than any other state. I think that we're moving in the right direction. And I'm very cautiously optimistic that we can go through the stabilization phase, which we're in now, and get to the recovery phase, which will come soon. In fact, we'll be talking about some plans we have for rebounding, for the recovery of the economy, how we get out of this pandemic and into a strong economic recovery. We're working on that now, and we'll have that probably announced sometime next week. Dr. Dunn?
Great. And for Dr. Dunn, first off, are we seeing, I know we've seen the numbers reflect Memorial Day at this point. Are we seeing any of the numbers reflect the mass protests in Salt Lake City and southern Utah? And also, what are the numbers in southern Utah telling you at this point?
Yeah, so we haven't noticed anything in our surveillance system or through our case investigations that point to protests as a source of spread. If we do see that, we'll certainly let you guys know. In the Southwest area, we're still seeing increasing cases in Washington County and St. George. This trend has been continuing over the past several weeks, so it's definitely an area that we continue to watch and work with the local health department and our community partners there to really enforce and get the messaging out about physical distancing, wearing face coverings, and staying home when you're ill. I mean, that's something that we all can apply to our lives throughout the state, but Southwest in particular is being hit pretty hard right now.
Yeah, really somewhat of a surprise to me, but Washington County and Iron County, maybe it's people are going down there to visit kind of the summer months and some of the activities they have available down there. But we're monitoring each county by county to see what the spread is and what the rates are. Most of the state really is in that kind of yellow area, and some maybe have the opportunity to move to green in some of the rural parts. But the data is going to inform us. The data is going to guide us. As I said before, we're not going to be governed by fear. We're not going to be governed by politics. We're going to let the data, and that's all different kinds of data, hospitalization, availabilities, as well as the infection rates and other things that help us make the decision on what is the right designation, the right level of restriction to be in place to help us get the state back on good, solid economic footing.
Yes, this one is for Dr. Dunn, and this one's about the curve that we see on the state website. You previously talked about the acceleration phase, and looking at the state's curve, there's been a bit of a decline and the note of a plateau despite still having some high counts reported. Can you explain this dip that's on the curve, and does this indicate the possibility of deceleration?
Sure. So we had a couple of days at the beginning of June that were very high in the 400 and 500s. And so that graph in particular takes the 3-day average of the previous days. So what we're seeing right now is a higher plateau. So we've been pretty consistent in the high 200s until today in terms of our case count. So for the past few days, we have seen a little bit of a stabilization. Again, you know, as you can see on that graph, it definitely can vary day to day. So we're going to look forward to really watching that trend over the next 2 weeks and hopefully continuing to see a decline.
Sound is horrible. And And a quick follow-up to that,
Sure.
what are the numbers that we should be looking for that would indicate possible deceleration in cases sometime in the future?
Yeah, so as we see, I mean, it's really about the growth rate, so the day-to-day rate of increase. And when you're seeing that plateau, it just means that rate of increase has been consistent. What we want to see is a decline in the growth rate every single day. We haven't had a chance to experience that yet in Utah, but we are working hard to get that done here.
Let me just mention too, Carter, that on a good note, what has stayed basically the very same, even though our infection rates have gone up, is that the fatality rate, the mortality rate, we're at really 1%. Again, about the lowest in the nation. So the end result, of course, we're concerned about is people dying. And our hospitalization rate is about 8% of those who get it. 92% that get it don't have to go to the hospital. So we've got some good things going there, and I don't want to dwell on the negative, but we are concerned about the infection rate going up, and that we hope doesn't translate into more deaths.
Hi, Dr. Dunn, Governor Herbert, thank you. This is Sophia Eppolito from the Associated Press. Dr. Dunn, I have a question for both of you, but I'll ask my question to Governor Herbert first, actually. If we see this spike continue, is there any scenario in which the state may shut down again, maybe at a point where we risk running out of hospital beds? Is that on the table at all?
We monitor that very closely, working very closely with our healthcare providers. In the early going, if you recall, that was our biggest concern, and what we saw happening around the world and in the country was that the healthcare system was overwhelmed, and consequently more risk to those who had the COVID-19 of death and having a more severe reaction. They just didn't have treatment. And so we've been very careful about that, making sure that we monitor our hospital opportunities, our hospital beds, and how many of those ICU units are being used for those COVID-19 patients. Right now, I think about 15% as all of our ICU beds are being used by COVID-19 patients. That's a good number, but it's something we need to watch and monitor. If we have spikes and that increases hospitalization rates, that would be an indication that we might have to do something else. And as you recall, the hospitals originally themselves said we're going to stop elective surgeries and elective medical needs in the hospitals. And that made sure that we had opportunity. We were not going to overwhelm. Well, now we've gone through 3 months of this now, which is really as long as this has been. It seems like 3 years, but it's really been 3 months to get from beginning to where we're at today. The hospitals have managed their rooms well, and we're going to monitor that and make sure that doesn't happen. What we don't want to do is go from getting into green and have to go back to yellow, or go to yellow and have to go back to orange. So we're being very careful about how we increase the restrictions or lessen the restrictions as we move from color and phase that in. But that's something that we look at every day to monitor the hospital utilization rates.
Thank you. And Dr. Dunn, I was wondering, is there any working theory right now on what exactly has caused this spike? I know we're attributing it back to Memorial Day, but can we definitively say, I guess, the state's reopening, or is it more along the lines of maybe people just haven't been taking social distancing as seriously, or what do we think the root cause of this is?
Yeah, I mean, I think it's all of the above, right? We have more people gathering and less physical distancing going on, and we expected that to happen. So what we're really relying on moving forward is for individuals to take that responsibility to physically distance when possible, wear a face covering when it's not possible, and staying home when you're ill. These are the key principles that will allow us to keep everybody healthy and safe while reopening the economy. So it's really essential to try to fight that fatigue. I know we've asked a lot of everybody over the past several months, but we're not at the end yet. So it's going to really take us a lot of discipline to continue taking these measures individually.
Next question.
Hi, good afternoon, Governor, Dr. Dunn. Governor, a couple of questions. First, actually for both of you, for the first question, what do you think of the Cache County Council decision to recommend moving from yellow to green? And Governor, second question would be related to police transparency and accountability, recognizing that this report is due by July 1st. What have you heard related to accountability and transparency for police? What do you think could be done now related to those concerns?
Well, the Cache County Council certainly has their right and their responsibility to analyze the data and make a request to whatever they think is best for Cache County. Again, as I've mentioned, the process is it starts with them, but then they have to work with the local health department, the Bear River Health Department, to see if they agree with their request. If you can't get that first level, there's no sense in submitting it to the state. But if the Bear River Council looks at it and says, well, you know, our infection rates are way up, but it's because of the meatpacking firm in Hiram, therefore we can justify the request to move to a better, less restrictive designation. So I'm not going to presuppose till I see the data. We have people in place that will come to our state health department. They'll analyze it, go to our group that's designed to make those kinds of decisions. And I expect that we'll have a decision in the next week whether their request will be granted or not. We have the recommendations that come from the legislative formed committee on economic response and review. So there's a number of moving parts, but we'll just have to wait and see how that plays out.
Dr. Dunn, how about you? What are you in favor of Cache County going from yellow to green?
So to my knowledge, I haven't heard any official requests that went to their Bear River Health Department. And so we as a state health department certainly support our local health officer in Bear River. So if that does come to fruition, we'll sit down with the local health department and give our best guidance there. But right now it's just still at that local elected official level and nothing yet to the Bear River Health Department. So we'll have to wait and see.
Okay. And related to the second question, Governor, what can be done in your view now to increase police transparency and accountability?
Let me just add a little bit, Brian, if I can. We have the ability to actually designate down to a zip code. So it could be that some parts of a county could be moved to green or moved to yellow, and other parts be it yellow or orange. We see that here in Salt Lake County. So understand that we are getting better, more surgical in this. And until we have the request and see the data, we don't know what the results are going to be. But we certainly entertain and we invite people to make their requests, and we'll reason together and see what's in the best interest, not only that local region, but the state as a whole. Now, the second question was on the transparency for the law enforcement. What are we doing?
Well, actually, the question is, what do you think can be done now? Based upon what you've heard, what you've seen, what you've studied, what do you think can be done right now to increase police accountability and transparency?
Well, as I said in my opening statement, you know, nobody's above the law and everybody should be treated equally above the law. And we should hold everybody accountable to that, and particularly those who are sworn to serve and protect the rest of us under the law. There have been ongoing discussions that are occurring, I know, in many different jurisdictions to make sure that there's an understanding. And we've already just announced that we're going to make sure and call upon all law enforcement agencies in the state, of which there are many. The municipal cities have them, the sheriff's office of the counties, some of our universities have their own law enforcement agencies. And we want to make sure that their policies align up directly and precisely with what's being taught at post. So for post-certified law enforcement, chokeholds, for example, are not allowed. Pressure on the neck and the spine are not allowed. Now, we have found that some local jurisdictions have amplified that, and we're saying that's not appropriate, and we're going to go back, and Commissioner Jess Anderson, who's the head of our public safety for the state, will make sure that all of these police jurisdictions are complying with what the post has trained them to do. I see that the Salt Lake City Police Department has made a change and said they're outlawing chokeholds and probably any restraints on the neck and the spine also. We're also going to change policy to say that those who are standing around observing have a responsibility, in fact, to intervene, meaning law enforcement officers. We're looking with the legislature to, in fact, see what should be put into law in the upcoming special session to codify what's just regulation and training into maybe an issue of statute. So those are the things that are happening right now. We also are in dialogue, so if there's other things that need to be done and recommendations are out there, which I'm sure we'll hear from, we'll look to not only discuss them, but if there's good recommendations out there to, in fact, modify our practices currently. And last but not least, as I've mentioned, I've elevated two of our people out there representing our underserved communities, Native Americans, and our multicultural communities of color are now elevated to virtually a cabinet position in our senior staff, where they'll report directly to us to keep us informed as far as what are some of the challenges we have and what we should be doing. So that's what we're doing now, and that's what we will continue to build upon. So it's not the end. It really is the beginning, and I'm going to be meeting in less than 30 days with those two commissions and see what other suggestions they would like to add to that we'll follow up on. One last question.
Hi, this is Haley Hendricks with ABC4 News. My question is to Dr. Dunn and Governor Herbert. From your guys' observation in your own lives, do you believe people are taking the coronavirus seriously? And what are your thoughts on making masks mandatory?
Let you go first.
Sure. So, what I'm hearing from across the state and our local public health departments is that there is kind of a more lax attitude towards physical distancing and face coverings and staying home when we're ill. And right now, the risk of spread of COVID-19 is higher than it's ever been in this epidemic. So we really want to impress upon people that these individual behaviors are essential for us to be able to stop the spread of COVID-19 and protect those at highest risk. With regards to making face coverings mandatory or not, I'll leave that to Governor Herbert.
That's a challenging question because I believe that most people are concerned. And people vote with their feet. In other words, if they don't feel safe at your restaurant, they're not going to show up and eat. And if you have a restaurant, for example, and you say all of our employees have face masks, we have sanitizer available, we're making sure that we clean the restaurant on a regular time frame, probably the public will say, that's a restaurant I want to go eat at because I think my risk factor is very low. It is about creating confidence in people in the marketplace, not only from employer to employees, but also for customers, whether they're retail outlets or wholesale outlets, that people can work in a safe environment. I think most people understand that. It's easy to become lackadaisical and complacent. He doesn't look nice outside. I can't see the virus. It's great to be outdoors. And we get back to our old habits, which is understandable. What we're saying to people is, this is serious. Most people believe it's serious. We're also asking something that's a little hard to do, and that's to change your habits. Change how you interact with people. Wear the mask when you can't have social distancing. As a precaution, as a safety measure for yourself to not catch the coronavirus, but also to not spread it. Studies would show that if all people in a room, an enclosed atmosphere is probably the worst case scenario, as opposed to being outside in the same space, you can have a reduction of probably 70% of your chances of catching the coronavirus, even though some in your circle there would have it. So wearing a mask is a smart thing to do to protect yourself and to help protect your neighbor. We have some out there that are being very cavalier about it. The fact that they introduce, well, that's my constitutional right. Maybe it is. Maybe it's not. Again, we've empowered the health department to make these decisions by our state legislature. It's the law. It's what they're empowered to do, to make these kind of decisions. I'm reluctant to, in fact, say it's the law, you have to wear a mask. I think that's a little bit hard to enforce, number one, and hard to get people to comply with, number two. And so, although it's a good idea, again, I'd like people say, should we make it a law that you, in fact, wear sunscreen? And that would be in your best interest if you're going outside. But a lot of people say, well, if I want to get burned, it's my choice to get burned. And at least in that instance, you're not burning somebody else's skin. But with this COVID virus, you may be spreading it. We've made it a law to have seat belts, but in fact, as we find people dead in highway accidents, they were not wearing their seat belt, even though it's a law. So compliance is a problem. This is just common sense application of what we all know that we probably should do, even though it's inconvenient and maybe it's not something we're used to. So we're calling on people to respect their neighbors, to show compassion and courtesies for their neighbor, and also to accept some individual responsibility. I said in the very beginning, if we don't all kind of work together on this, if we don't comply with the guidelines, we won't stop the spread. We'll have more people that in fact are sick and dying than we otherwise would have. And it will be harder for our economy to open up. So again, take on the challenge, all of us as Utahns, love your neighbor, and take on some responsibility to do what you can with proper hygiene and protocols. If we do that, we're going to get to a safe place quicker, and the economy is going to recover faster, and we will lead the nation as we've done in the past once again. So I'm very optimistic. I think we can do it. Together, we lead the nation. Thank you very much.